This program, while curated to help you improve your health, contains general advice and should not replace the individual advice of your medical practitioner.
We're taught not to talk about our bodies, not to talk about our symptoms. There are certain times in the menstrual cycle where we are stronger. If you see a pad or tampon commercial, they will be using something that looks like Windex or, some other chemical. It can't be red. It was my own journey of being on the pill, coming off, developing post-birth control syndrome, and being gaslighted by my doctor that made me really wake up to there is more to this pill story than what I was told.
In life, it's normal to have ups and downs. But what do we do when we get stuck? I've always been fascinated by the healing journey. Why do some people get better while others fail to make the shift? Welcome to the Season 2 Expert Series, where you'll meet 24 of the world's leaders in health discussing their passions and what it takes to make a shift.
We tend to be our harshest critics.
We are more than the muscle and bones in our body.
Whoa, that's so opposite of what I was taught growing up.
I would like a call to arms for women to know that their intuition isn't lying to them.
I'm Katherine Maslin, and this is The Shift. Hi, I'm Katherine Maslin, naturopath, author, and host of The Shift. In the Expert Series, we share the insight, stories, and expertise of each of our amazing experts. We're talking doctors, authors, naturopaths, researchers, and thought leaders. You may have heard them on Season 2 of The Shift, where we took snippets of these interviews to put them together in the series for you. If you haven't listened to Season 2 yet, I'd highly recommend checking out Episode 1, which will give you an overview of what constitutes women's hormonal health and a sneak peek into the series. We'll provide a link in the show notes. In this episode of The Shift, we have Dr. Jolene Brighten. Dr. Brighten is a board-certified naturopathic endocrinologist, clinical sexologist, and prominent leader in women's medicine. A fierce patient advocate and completely dedicated to uncovering the root cause of hormonal imbalances, Dr. Brighten empowers women worldwide to take control of their health and their hormones. She is an international speaker, clinical educator, medical advisor within the tech community, and considered a leading authority on women's health. She is the author of 2 books, the bestseller Beyond the Pill, and her newly released book, Is This Normal? Dr. Brighten is also a part of the MindBodyGreen Collective and a faculty member for the American Academy of Anti-Aging Medicine. Her work has been featured in the New York Post, Forbes, Cosmopolitan, Huffington Post, Bustle, The Guardian, and ABC News. There is a heap of eye-opening content in this one, so please strap in, keep an open mind, and take what you need from this episode of The Shift. Dr. Jolene Brighten, thank you so much for joining me today. I'm so excited for this conversation. To begin with, can you just start with telling everyone what you do?
Yeah, so I am a women's health naturopathic physician who's done postdoctorate training in functional medicine as well. And I have a women's health clinic, and I focus on hormonal issues primarily, which also always bridges and marries into autoimmunity because it's us gals who are affected by that the most. And I'm the author of the book Beyond the Pill, which is the first book to really detail what birth control can do to your body, giving you a true informed consent and letting you know how to stay safe on it, transition off when you're ready, and what other options are available other than just being given birth control. So
there is so much that I want to dig into with you. But to begin with, can you tell me your story? How did you come to be so deep in the world of women's health and this massive advocate for, health and transparency when it comes to women's medication and how they look after their bodies?
Mm-hmm. So, the funny thing is I thought I was going to be a gut doc. So I've had this twisty, turny road in health. So I actually started in dentistry when I was 16, went back to college in my 20s, thought I would become a dentist, got bit by a dog on my right hand as I was studying for my DAT and decided, which is the dental entrance exam. And I was like, yeah, this isn't going to work after talking with several dentists. And I was wrapping up my degree in nutrition and looking at next steps. And so I decided to get my master's in nutrition. And I actually had a scholarship to get my master's and then subsequently my PhD at UC Davis. And then I realized that I could do all the best research and have, all this information come out guys, social media wasn't a thing back then. Like, I was in college and college students could be on Facebook. So, and people were still on MySpace. But, I could do this research, but it didn't mean it was going to change anything. It wouldn't change anything for the individual if they didn't read it. And it wouldn't change anything in practice, because at that time, doctors were like, you're crazy if you talk about food. And my cohort, who were going off to be registered dietitians, they were discouraged by being in hospitals, and doctors wouldn't refer to the dietitians because they didn't believe that nutrition did anything. Mind you, I'm using the word belief because that's what it is.
When are we talking here? What year was this?
When was this? This is like mid-2000s.
Okay.
Yeah, early 2000s. Y'all are going to know how old I am. Yeah, so, I ended up finding naturopathic medicine. Now, I was studying the MCAT. I was going to go the conventional medicine route, but I wanted to practice a medicine that respected nutrition, that looked at the body as a whole system. And when I found naturopathic medicine, it resonated with me. And so I was like, I have all this science. I was studying molecular nutrition, and I brought that over into naturopathic medicine, which is a philosophy that asks why. Why do you have these symptoms? We, contrary to popular belief, we do believe in pharmaceuticals. Well, we see there's evidence in their science to support pharmaceuticals, but it's one tool of the many tools. And so much of our approach is to look at what can we do truly preventative medicine-wise with diet, lifestyle. So there I am, naturopathic school. I'm like, I'm going to study gut health. Because as a kid, I had significant gut health issues. So and you guys, we're going to talk. You want a hormone doc who understands gut health, because it is everything. But it was really being in school that I realized that so much of women's medicine was done to them, not with them. I had great mentors, one of which is Dr. Carrie Jones that we were talking about before we started recording, who showed me how to do a gyne exam and reinforce the notion of consent. So this is, the mid-2000s, and I had never had a gyne exam where I was asked permission to be touched. I was told, I'm going to touch, I'm inserting the speculum. And it seems so subtle, but for me, it was such a paradigm shift in that moment to say, wow, this is her body and it is her right to say no. And wow, as a doctor, we actually disempower and take away consent, like this notion that you could have it as we wear this white coat and we perform these procedures. So I really just wanted to do women's medicine differently. Coming from a nutritional biochemistry background, you throw molecular pathways at me and I'm all about it. So hormones was like, of course, this is fun. And, it was my own journey of being on the pill, coming off, developing post-birth control syndrome, and being gaslighted by my doctor that made me really wake up to there is more to this pill story than what I was told. Now, I'm a first-generation college student, so I'm not anti-birth control. I come from this huge family. If it wasn't for birth control, it would be 3 times the size. And because of it, it's a tool that I used. It was, for me personally, the right choice for me not to become pregnant while I was in college. But there was so much I was never told. When I look back, I'm like, I never really got the informed consent, and not because my doctor was a bad person, but because there's just so much information about birth control that doctors don't even receive, that I get into conversations with researchers and my eyes are open, because this isn't part of clinical training. We're all taught the birth control pill is the best thing that ever happened to women. Take it, say thank you, don't question it because they might take it away, which is the tricky thing. We have to advocate for access while we also advocate for information, education, and help women make the best decision for themselves. And so, I thought I was a freak, and I thought I was the only one that could have lost their period coming off of birth control or had any of these things happen. It was once I was in clinical practice that I realized that, wow, the majority of women struggle when they break up with birth control. And there is a lot of research out there showing us how it touches every single system in your body. And it all makes sense. It's a huge hormonal shift, right? I love that I'm on the Shift podcast talking about hormonal shifts. That just to say that, we respect that pregnancy, childbirth, menopause, menarche, that all of these hormonal transitions, there can be hiccups involved. There can be symptoms that come with it. But when we talk about birth control, a huge hormonal shift. We put the reproductive system on hiatus and then we stop and say, come back online. we expect that women shouldn't skip a beat. And it's really not fair to the women who are struggling, to the thousands. No, yeah, I'm wrong. It would be millions of women who are out there sharing their birth control stories, but being told that it's all in their head.
So let's dig in a little bit. Can you start with telling me, how does birth control actually work?
This was, you shouldn't have to go to medical school to understand your body or how this pharmaceutical that is handed out like candy works. And yet I did. I did not know how my menstrual cycle worked until medical school. So anyone listening, if that's true for you, no shame. But with birth control, how the pill specifically works, how any of these medications work to shut down the ovulation cycle is on the brain. So it's a high enough dose of hormones to tell your brain to stop talking to your ovaries. And then you are no longer this cyclical creature. You are static with these hormones. So you don't ovulate, which is fantastic, right? If you don't want to get pregnant, that's a great mechanism. So this is the primary mechanism, how birth control works. Now, when it comes to like progestin IUD, some women do continue to ovulate. But progestin, not progesterone, progestin also has the benefit of changing the cervical mucus so that sperm can't reach the egg. Some of these will also alter fallopian tube motility. So if you did happen to ovulate, you will not usher that egg to meet the sperm. And then they also have a mechanism of shutting down the receptors in the endometrial lining so that your endometrium, this is what we shed monthly if we're cycling naturally, your endometrium doesn't build up. So even if an egg became fertilized, it wouldn't be able to implant. And this is a moment where some women are like, oh my gosh, like, wait, so the pill is an abortifactant? Well, not technically speaking. So from a scientific perspective, once implantation occurs, that is when conception is defined. If your belief is different than that, I'm not here to argue beliefs. I believe everybody has a right to their beliefs, but just to understand that that is a way down the line if all else fails mechanism, but it is a mechanism that comes into play for some women if everything else didn't work. But, the pill is pretty effective at shutting down ovulation. It's about 91% effective with typical use.
Why do you think there's so much of a misunderstanding about, A, the way that the pill works, but also just in general women not understanding their body and what happens?
So number one is we're taught not to talk about our bodies, not to talk about our symptoms. We're taught that periods make people embarrassed and uncomfortable. Like it is only like in the last handful of years, I think it was 2015 that was declared the year of the period. 2015. Like, I don't know. There's a whole human species walking around. We've been having periods for a long time. So to understand that there is this societal norm of things about a woman's body, they're taboo, they're not to be spoken about. We even get these subtle ways of feeling ashamed through TV commercials. I don't know the last time I saw a woman that bled blue. We don't bleed Windex, but yet if you see a pad or tampon commercial, they will be using something that looks like Windex or, some other chemical. It can't be read. There's also the part where women have been largely left out of research. It wasn't until the late 90s that the FDA was like, hey, hold up. Maybe women aren't just small men. Maybe women aren't just, the inferior version, which is a lot of what medicine had been carrying forward, is that the male is the standard and the women, they just come with these reproductive parts. They just have these, couple things that are different. We're finding now that women are being included in research. It's not true. And, another piece in all of this I think is really important for people to understand is just because now the FDA says let's include women in research doesn't mean they're accounting for the sex differences. Sometimes they are taking out the sex differences so that they can have statistically significant research. So we've got an issue that for a long time, we weren't studying women's bodies, not in research, and even in medicine. I mean, it took a long time to figure out the clitoris. Come on, medicine. So we've got that aspect. We've got underfunding in women's medicine and women's health issues. I mean, so many conditions that women face. In 2020, I shouldn't be sitting here saying, I don't know what causes endometriosis. I don't know what causes polycystic ovarian syndrome. We've got some ideas, but if we'd been doing our due diligence in research decades ago, we'd be a lot closer to answering that.
Can you tell people why women were excluded from research?
We're complicated. So it is so much easier to take a non-cyclical creature. Now, men cycle in a 24-hour period, but just to take them and include that and have them in the research and then just say, okay, same, apply it to a woman. We just make humans in our bodies. I don't know. We produce milk. Like there's some significant differences here, right? So there's that piece. There's also the ethical considerations, right? If we have a woman in her reproductive years and she could potentially fall pregnant or is pregnant, like it's, why can't we tell you exactly what happens if you take plan B and you end up being pregnant and it fails? Like, because we don't have studies. We have what we've observed in the population that we're like, seems fine. But, people are like, well, until there's a randomized control trial, I'm like, that would be unethical. Okay, there's ethical considerations with a female body as well. If you are a creator of life, we have to think about that future life. So there's that piece. There's also the piece that like our menstrual cycle and our hormones can complicate things, right? Like, so if you're doing a study and you're wanting to see, oh, how does this drug work for headaches? Could work really, really well for the average person, but maybe she has cyclical migraines. And that drug isn't meant to address the root cause of that cyclical migraine. So it can add, it murkies the water, so to speak. So that makes it, researchers want really clean data and they want to be able to explain every piece of what's going on. Women introduce a lot of variables in that arena, which is why we see in some of the athletic research that they will try to control for our cycle by putting women on birth control, which is hilarious to me because I'm like, no, now you just like brought in a whole new variable. But they're like, if we can just stop all of that, then we can study this. And it's kind of good that they've done that a bit because now they've started to see, well, wait a minute, birth control might actually affect athletic performance and body composition. And maybe the answer isn't to actually shut down her entire menstrual cycle, but rather to work with it. Hello, U.S. soccer team, winning like champs because they actually leveraged their cycle in their athletic goals, performance, and training. That's in part what they point to in achieving the World Cup. Like, how incredible is that?
Can you tell me more about that?
Yeah. So there are certain times in the menstrual cycle where we are stronger, where we have more gains within the gym, maybe weightlifting or in our performance. Turns out that being on your period doesn't make you weaker. It actually makes you stronger. Oh, whoa. That's so opposite of what I was taught growing up. So there's certain times within the cycle where you're going to see that you can have greater gains. There's other times in the cycle where you're going to maybe feel a little more fatigued. So like leading up to your period, you might fatigue a little bit easier. I mean, a lot of women feel tired. You're about to shed your endometrial lining. It's okay to pause and rest. So with that, it's really looking at, okay, when can we push and hit it hard to make the gains? When would be good recovery weeks? When are times that we should be focusing on flexibility? When are we more prone to injury? What's really interesting as we talk about soccer is that there have been studies showing that if you sustain a head injury, which this is why I'm like, don't want my kid to play soccer. Sorry to the soccer people, but the ball is, you're using your head on the ball. Like that's like trauma. So with that though, they found that if these female soccer players sustained an injury and they were menstruating, they were more likely to recover a month later. But if they were within the 2 weeks of the luteal phase, they were more likely to have deficits later. And the hypothesis for this is how nourishing progesterone is for the brain and how it helps with brain inflammation. If you get a head injury, you roll into ovulation, now you've got progesterone flowing from the corpus luteum of your ovaries. That can be neuroprotective. That can actually help your brain heal. But if you are in that luteal phase window, you're about to experience a drop in these hormones. And we're now coming to understand that estrogen and progesterone, specifically, I mean, all hormones have effects on the brain, but these ones are super protective. They help with neuroplasticity, so our ability to learn new things. They're part of the myelin sheath being built. That's basically like, if we've all seen that ugly orange extension cord, it's the orange casing that helps that electrical current be conducted. So there's a lot of ways that our sex hormones are neuroprotective. And when we're talking about athletic performance, that's also, very much tied into our nervous system as well. But it just fascinates me to think about, wow, where you are in your menstrual cycle can be the make or break moment for some people in terms of how they recover from a head injury.
Tell me what you found with your research on the oral contraceptive pill and what it does in the human body.
Man, this is where everybody just take a breath, because it impacts every single system in your body, but it may still be the very tool that you need to use with your life circumstances. So here's the thing that we aren't often told. Every single system in the body has receptors for hormones, which means that your natural hormones impact every single system in the body. But somewhere along the way, there's this disconnect when it comes to birth control. It's almost like your hormones, your natural hormones are vilified, and then birth control is like put on the shelf as this, like, it's the best thing that ever happened to us, right? And it couldn't do any harm by some people. Not everybody has that perspective. So what's really interesting about hormonal birth control is that there are a lot of side effects that women have complained about since the introduction of the pill, since the early trials of birth control, and yet have been dismissed over and over by doctors. And even in the research, it's been like, so we take the depression link, right? At this time, we don't have any research to say that birth control causes depression, but we do have studies to show an association. And yet for decades, we had research that was actually poorly done, saying there was no connection whatsoever. So women are getting on birth control, they're crying their eyes out. I had a formulation of the pill that happened to me. They're having anxiety, panic attacks, and they're being told, it's just you. Women, here's this story that's played out forever, are hysterical or emotional, and you're just met with another medication. It wasn't until 2016 that we had a large study of over 1 million women come out and show us that, 23% more likely to be prescribed an antidepressant and receive the diagnosis of depression if you start the pill. And everybody's like, oh, it's not estrogen again. And then the research kept coming, showing us that IUDs aren't much better, that progestin-based aren't much better. So that's just one aspect. Why I bring that up is because as soon as that study came out, there were people lining up, doctors, researchers, Google experts, to dismiss women. And to say, like, it was the first time a study came out and validated women, that women were like, oh my gosh, I knew it wasn't me. I knew it wasn't broken. And finally, maybe my doctor will listen to me. And then you saw people saying, well, this study's only observational. This is not, it's not a randomized control trial. So no, it's not real. And that blow to women, we had women writing us just saying, like, this story's come back. Now I'm just crazy again. My doctor refuses to even read the study and says it wasn't well done. And like, here it all came. Then I'm like, it's very easy and convenient to dismiss women, to gaslight women, and to say, oh, it's all in your head. However, it is in your head, because that's where it's eliciting its effect, right? If you're on birth control, okay, so the hormones, they're in your head. However, when you talk with researchers, what's so interesting, and it just is really striking to me, you'll talk to clinicians and they feel like it's black and white. I read the study, you will either have this experience or you will not. And when you talk to researchers, they always bring up this interesting point that everybody really needs to grasp, and that is, it's gray. And we always expect there to be outliers. And when you report research, you are reporting what is statistically significant. Sometimes, decades later, sometimes, a few years later, they start to figure out, oh, this is what that data means. This is what might be going on. But just because it didn't get reported on and it's not being sensationalized by the news doesn't mean there's not outliers. We expect paradoxical effects to medications. We expect that people are going to have different responses. Birth control is no different. And this is the thing that we often forget. It is a pharmaceutical. It is a drug. It is a medication, and that isn't going to have the same effect on every single woman. One of the things that blew my mind, and I always question this when I got into the research and saw that there were case studies in which doctors were reporting that they had higher incidences of Crohn's disease. More often, women with Crohn's disease were getting surgeries while they were using the pill. This was back in the 1970s, and we've seen more research coming out showing that, birth control is one of the many pharmaceuticals that can mess with the microbiome. In fact, some researchers have compared it to the effects of antibiotics on the microbiome. It can lead to intestinal hyperpermeability. So just like your NSAIDs and other pharmaceuticals can, this can cause what most people know as leaky gut. And if you have a family history of Crohn's disease, which is to say you have the genetics, then there's a study that says you're a 300% increased risk after 5 years on the pill of developing Crohn's disease. There are studies that have shown us that you may require additional surgeries. And there were case studies, back in the 70s, 80s, looking at, wow, and if we remove birth control, some of these inflammatory bowel disease patients go right into remission. Like, that was mind-blowing. And here I was at 17, just clearing an H. pylori infection, but, still having some GI issues here and there. And I started the pill and I'm like, wow, I wish I would have known about that. So there's that piece. There's the connection with autoimmunity. So interstitial cystitis, Crohn's disease, ulcerative colitis, those studies aren't great. There were smokers included. So that could be, that's a confounding variable right there. That could potentially be what, was really the trigger. And we also see, things like lupus are connected to hormones. So why not hormonal birth control? Yes, we have some research on that as well. When I was getting my degree in nutrition, we were taught birth control could lead to nutrient deficiencies. This is something that, I remember sitting in class, here I am in my 20s, looking at this slide, and I'm like, whoa, hold up. I'm being taught on one hand that multivitamins are just expensive pee and that we should focus on food first. I agree, you should focus on food first. But it's very hard that I've seen clinically to out-diet the birth control pill. It touches so many nutrients. So B12, folate, magnesium, zinc, selenium, vitamin C, vitamin E, CoQ10, these are the ones that we know about. And so this is what I was taught when I was getting my nutrition degree. And it always surprises me when I'm talking with people and they're like, I need to see your research. I don't believe this. I need to see the studies. And I'm like, when it's part of core curriculum, no, you don't have to necessarily see the study. It is being taught in universities. This is a real phenomenon. And that's the thing is, I think, important for people to understand is that when you're saying things that are not generally accepted, yeah, you should bring your research. When you're saying things that are part of core curriculum education in a very conventional nutrition program, that's something where it's this is known, okay? I will still bring you the research. It all exists in Beyond the Pill at drbrighten.com. I'm happy to always share it. But it's so interesting to me that decades later, after I've been taught this, people are still questioning, is that even true?
Want to look deeper into your own health? Our virtual naturopathic team help people all over the world to shift their health and their lives. We offer a 90-minute online discovery and diagnostic session where you can find out where you're at, why things are happening, and what you need to do about it. Everyone is an individual, and sometimes it can help to have someone break down your journey and see where you need to head next. To find out more, go to theshiftclinic.com and click on Clinic. What about risk of infertility after taking the pill?
So at this time, we do not have any research to show that birth control leads to infertility. But there are lots of women reporting this. So why might that be? A really big reason is we're using birth control for symptom management without ever asking why those symptoms are there in the first place. So if you have a woman with polycystic ovarian syndrome, she may have acne, started birth control at 14 for acne, her irregular periods, and then at 34, she wants to get pregnant. She comes off of birth control and now she's unable to. Well, it makes sense that she's going to look at the pill and be like, that's what did it to me. Or look at, her IUD. That's what did it to me. And yet PCOS is associated with infertility. The same is true for endometriosis. So maybe she started birth control because her periods were excruciatingly painful. Thank goodness we have this tool to get her out of pain, because for endo women, some of them spend 2 weeks out of every month just in excruciating pain, not being able to live life. When we put that into perspective, that's 6 months out of the year. That's half of her life is gone due to pain. She may have been put on birth control. No one investigated. Nobody treated her with any other means. And when she got into her 30s, decided she wanted to have a baby, now she has found there's adhesions. Now she's unable to conceive. Same is true with hypothyroidism. That can present with irregular periods. And I've seen plenty of patients be given birth control to regulate their period. I'm doing air quotes here because it doesn't actually regulate your period. It just shuts that whole business down. And it turns out that she's actually hypothyroid, and that's what needed to be addressed. Hypothyroidism is also associated with infertility. So there's that piece. There may be a pre-existing condition. There's also the other piece of why do we use birth control? Like if we're not managing symptoms, to delay conception. And so women may be delaying conception up until like 38, come off because they were told as a teenager, when you come off, you'll be able to get pregnant right away. That's actually not true. Clinically, I don't find that is true, that you'll get pregnant right away. When you look at the research with the pill, your average woman, nothing going on, no pre-existing conditions. It can take 3 months to start ovulating regularly and having your period after you stop birth control. If you had PCOS, it could take 6 months. If you're on the depot shot, it could actually take 18 months for your entire system to get back online to be able to get pregnant. And we also see, that the endometrial lining. So as I talked about before, the down regulation in receptors so that you don't grow your endometrial lining, that can take time to heal as well. So these are temporary, okay? There's nothing that's been shown to say this is long-term, there's no coming back from this. But if you stop the pill or you are like, I'll just stop my depot shot, I won't get the next one, in your late 30s, well, you might not have the time to conceive naturally. And you might be going into reproductive technology, which thank goodness that we have access to that. So it's important to understand that birth control was designed for young, healthy females to space pregnancy or delay pregnancy. And now we are kicking ass as women, and we are CEOs of companies, and we are ruling the world, but we're also delaying conception until our 30s and sometimes our late 30s, early 40s. And so it's important to understand that there may be a temporary hiccup when you come off in your ability to conceive. And so if you're going to plan on having a kid in the near future, then it's a good idea to talk to your doctor about coming off. With my patients, my ideal is like, can we spend 2 years? Like that, I think, is ideal to get what I call pre-baby body ready. Can we just like clean house, get everything ready, like just really work on all of that? Because yes, there's the physiology, but there's also the like, what's your relationship like? You should do some work on that. I don't know if you have kids, but I have one, and I will tell you, is the fastest way to accelerate relationship growth, because all of your problems that we're like, I can deal, you can't deal. You're like, no, we got to fix this. This is a problem, because you're so dependent on each other at that point. So, but 2 years might not be realistic. 1 year, so if you're on depot, you want to get on a different method, at least 18 months in advance. If you are using the pill, the patch, the ring, IUD, you really want to be looking at like 6 months or more. There is research showing that it can take up to 9 months, sometimes up to 12 months for women to get pregnant after the pill. So it really just depends, and we just have to be honest in planning for that. Otherwise, when you come off, you're going to be like, birth control made me infertile. Well, we don't have any evidence of that. The evidence we do have says it's temporary, and it may very well be the timing of everything, which is why we just have to have these open conversations and be real about it. Because if you're 35 right now, you're going to want to start planning for that transition off and when you're going to want to become pregnant. Really, 6 months is the minimum. And for women who are really like wanting to go all in, we can hit 2 years. But I also understand, as a woman who never wanted a baby and then wanted a baby, you want a baby like yesterday. Like there is no like, oh yeah, let me just wait 3 to 6 months. You're like, no, I need a baby. I'm not holding a baby. There's a problem here. So it is something that we also have to just meet people where they're at, of like, okay, what's realistic for you in terms of preconception care? And really, if you're on birth control now, understand it is depleting folate, B12, and crucial nutrients for fetal development. If you're on a pharmaceutical that, you can deplete these nutrients, and you know that the contraceptive pill is only 91% effective with typical use. 9 out of 100 women will become pregnant in a year. If that's true for you, you want to be on a multivitamin or prenatal to be replenishing those nutrient stores, because by the time you find out you're pregnant, that baby already needed folate. So we want to be making sure that we are first doing no harm. And so if you're sexually active with males and you're relying on the pill, if you're on the IUD, your odds of getting pregnant are really low. But my goodness, they're like, every time I say that, I'm going to say that. Somebody's going to write a comment and be like, nope, happened to me, because it does happen. Nature is smart and it finds a way. It really does. So it's just really important to understand that we don't have any research that says that it causes infertility, but those are some of the reasons why we may have the perspective that it does. And I'm very cautious in talking about this because, like I said earlier, there may be a study that comes out in the future and shows in a certain population, this certain demographic, it may very well be a contributing factor. We don't have that research right now, but when we do, that's going to change the conversation and we will be able to advise women better. I mean, we all know the woman who got pregnant on birth control. We all know the woman who got pregnant immediately coming off of birth control. That also does happen. So I'm not saying like, oh, it's impossible, but it may take you longer and you want to plan for it.
My mother was taking birth control when she conceived me. So miracle. But it's interesting because just from observation in patients, I thought there has to be research that shows that there's this link with infertility or amenorrhea or anything. And I couldn't find anything. And this was quite a few years back when I was doing a bit of digging, but just observationally, you know, it would sort of make sense that if you're taking something that shuts down, you know, that natural cycling response, that there's going to be some impact from that. Unfortunately, most of our patients at Shift already want to be pregnant yesterday.
Yeah.
So what I want to kind of touch on actually is I want to go back a little bit and talk about what about in kids? So, I mean, we're seeing kids getting their periods earlier and earlier. Do you have anything to say about that? And also, what about the use of the oral contraceptive pill in young teenagers? What does that do for their reproductive trajectory?
There is a researcher, Dr. Jolene Brighten, she's a brilliant woman doing research on ovulation, the benefits of ovulation. And something that she has said that has really struck a chord with me is that it's anticipated to be about a 10-year maturation period for brain-ovarian communication to be established. So she's raised the question, what happens when we start birth control and we interrupt that maturation process? This is part of what I feel like might be what's going on with post-birth control syndrome and why some women, and this is what I've seen in patients, the younger they started it, the harder that transition is to come off. And I hate to say it, guys, but puberty might be necessary. Like, nobody likes it, but it might be necessary because, and it really dawned on me with Dr. Pryor's work and then hearing from so many of my patients saying like, why am I 42 and I feel like I'm going through puberty, and over again. And to see the younger you're put on, the more problematic that this can be for you. So in terms of making that transition might be linked to that maturation process being interrupted. Now, when it comes to teens, we really have to be mindful of screening for risk of depression because they are at the highest risk of depression, and not just the highest risk of depression, but the highest risk of suicide. So the suicide rates tend to peak within the first 2 months of starting birth control. And so whenever I'm lecturing to prescribers, I tell them, look, I'm not advocating for teen pregnancy. I am not advocating for this, but what I am advocating for is that we screen her. So do a mini mental health intake, get a baseline on her. Does she have a family history or personal history of any mood disorders? We should know about that. 2 months later, can someone give her a call and redo the mini mental health screening exam and just find out where she's at? Now, the other thing that you won't find research drawing a direct line between birth control and depression risk are ACE scores. But this is something I talk about because I don't think it takes a huge leap to understand that adverse childhood events, that's the ACE score. You guys can look it up. There's a little scoring system of like, were you abused as a child, physically, sexually, verbally? Did a primary relative in your house end up going to prison? Like, these different factors do contribute to mental health issues. So if you know what her ACE score is, then it doesn't take a leap to say, okay, I'm going to put you on a medication. It is associated with a new onset of depression, to say, I need to keep tabs on you. I just want to make sure that you're okay. I actually lectured at this conference with 5,000 prescribers in the room, and it was actually striking the number of male gynecologists who came up to me and said, we're actually going to go through our patient database and we're going to start calling our patients. We're going to start checking up on our patients. Like, thank you so much for saying this, because I realized I've been prescribing. There was one doctor who's like, I've been prescribing birth control for 25 years. And I'm realizing that I've never really asked about mood. I just expected if they had mood issues, they'd bring it to me. And I'm like, that's the thing about mental health, though. We're also told not to talk about that, and that can keep some of us from seeking help and getting the care that we need. So these are issues that I have with prescribing birth control to teens, and I get, really concerned that she could go and start birth control and nobody could know it. Now, this is tricky, right? Because she has a right to control her reproductive health. We don't know what's going on in her house or in her life. And, some people, they hate the concept that a young woman can go get birth control without her parents ever knowing it. We don't know what's going on with her parents. We don't know. There are just really ugly things in this world that you are only privy to sometimes when you are behind a closed door with these people. So to understand that, we do need to have access. And so what I advocate for is that if you're not able to talk to your parents about it, tell a friend. Tell a friend, I'm starting birth control. And if I start dodging your text messages and I'm not interested in that cute boy anymore, and I don't show up to volleyball practice, which I live and breathe, and when you start to, be impacted in your daily living, have somebody who can take note and take you to the doctor and remind you that you started this birth control, you need to talk to your doctor about it, because sometimes just a change in the formulation is all women need, or a change in the type of contraceptive is all they need to really lift the curtain and all of that. So we have to be careful when we're prescribing to this very vulnerable population. And there are more studies that are coming out showing us that we don't have to withhold birth control from them, but we need to inform them of what is possible and tell you as a doctor, if you don't tell a patient when they need to come see you, they don't know. And it's not fair to put that on them. And people who are struggling with mental health, when you get into that cloud, I remember when I took a formulation of the pill, I couldn't get out of the shower. I was just sitting there crying until the water turned cold. And my boyfriend at the time is like, something is wrong with you. And he was the one that was like, you started this pill and you are crazy now. You are just going crazy. And when I went to my doctor and I asked about it, he's like, I don't think it's your pill. I don't think it's that, but let's just change the formulation. And I changed the formulation and I was me again. So there's something to that. Me as an individual can say, that pill was causing my depression. Me as a doctor can't ever say that's true for you because I don't have the research to back that up. But why I share that is if you feel like that's true for you, then your doctor should believe your story.
Have you listened to season 1 of The Shift? If you're enjoying this conversation, you'll love season 1, where we deep dive into the field of gut health with 24 of the world leaders in this area. Once you're done, head back to your podcast app and find episode 1. It's a great place to start. Tell me about the role of thyroid in women's health and I guess why it's such a massive issue right now.
So within the United States, it's estimated about 27 million Americans have thyroid disease, and half of them don't even know it. The majority of which are women. Women are affected by hypothyroidism and autoimmune thyroid disease at a much greater rate than men. So with that, it's important to understand a few things. One is, we used to think that thyroid conditions predominantly just affected older people. So we thought, okay, it's like a geriatric condition. Then we started seeing it more in women in their 30s getting diagnosed. And now we're seeing, I've diagnosed it in 8-year-olds. Now, thyroid is so crucial. Every single cell in your body has receptors for thyroid hormone. And so you can't live without it. And this is always the one where when people say, well, I don't want to be on a medication, I don't like pharmaceuticals. You cannot live without thyroid hormone. It is incompatible with life to be hypothyroid. So, and I'm hypothyroid. I take a medication every day. I will tell you firsthand, it is not living what is happening while you are hypothyroid. So with thyroid disease, we see manifestation in so many different systems, and that is because it affects every single system. This is how hormones work. They're little chemical messengers going out, orchestrating everything going on in your body. So there's 2 main thyroid conditions, hyperthyroid and hypothyroidism. Hyperthyroid is driven by Graves' disease, which is where antibodies actually dock onto your thyroid, stimulate it, then it releases thyroid hormone. That is more rare than Hashimoto's, which is autoimmune hypothyroidism. So it's important to understand that within developed nations, the number 1 cause of hypothyroidism is autoimmune. Although for a long time we were like, it's because we don't have iodine, not so much in a developed nation. So understand that with Hashimoto's, this is where antibodies actually flag the thyroid for destruction. They don't actually do the destroying. So I grew up in the mountains, so I think about that when they flag trees to be cut down, and there's the guy who goes out and he puts the big orange X on the tree. He flagged it, but he's not the one that's going to cut it down. The other guy with the equipment comes in and cuts the tree down, and that's the immune system. So in Graves', we're going to stimulate with an antibody. That's going to lead to the symptoms. In Hashimoto's, we're going to tag, flag, and then the T cells are going to come in and destroy. Now, why this is important to understand is that antibodies can show up. We see this in multiple autoimmune conditions, but along with Hashimoto's as well, up to a decade before you have symptoms. So it's so important that every woman has antibody screening as part of her annual exam, along with a full thyroid panel. And so these antibodies can show up. Then what happens next is that we start to get these weird symptoms. So with hypothyroidism can show up in some weird symptoms. So your thyroid is responsible for your motility in your gut, your menses, your mood, your metabolism. So those are some big areas where people are like, yeah, so if you're hypothyroid, you're going to gain weight, you won't poop, you have dry skin, you can lose the lateral third of your eyebrows, you can have hair loss going on, but you can also have heartburn. That could be a symptom of hypothyroidism because thyroid stimulates the parietal cells that release hydrochloric acid in the stomach. And if you have that issue, you're going to have a whole lot of downstream issues in your gut, which I'm going to say, go back and listen to season 1 of The Shift so that you get caught up on that. But it also can manifest as changes in your voice. So your voice can become gravelly and deeper. We can also see that, yes, there's joint pain and fatigue, but it might be subtle, that when you wake up in the morning and you step out of bed, your feet are incredibly painful, your hands are incredibly painful, and you haven't done anything. So, other ways that hypothyroidism can show up big time for women is in infertility and also amenorrhea or irregular periods. So loss of your period or irregular periods. Now, the reason for this, what the hypothesis is that the same mechanism in the brain that causes thyroid stimulating hormone to go up, TSH, what your brain says to your thyroid, also causes prolactin to elevate as well, which is great if you're feeding a baby, but not so great if you want to make a baby. And so we see this very intimate connection between thyroid hormone and the reproductive system. And, up until recently, it was actually recommended that if you had a TSH of 2.5 or higher and you're trying to conceive, thyroid medication should be initiated. Now the guidelines have shifted a little bit within the United States. Globally, we're still seeing many countries are like, we need to give thyroid medication. And that's because, one, elevated TPO antibodies or elevated TSH is associated with increased risk of miscarriage. But we've also come to understand that if we don't have adequate T4 is what your thyroid primarily makes. It's inactive, but it crosses the placenta. And if we don't have adequate T4, especially in the first trimester of pregnancy, that can impact babies' cognitive development and motor skills. There's actually a study where they tracked a cohort. They didn't induce hypothyroidism in women. They just measured and tested and saw where her T4 was. And they observed that that cohort, even up to 16 years of age, was significantly behind people their same age because their mom didn't have adequate thyroid hormone. So baby's going to depend on that until you get into the second trimester, which is why we also have to screen early on in pregnancy. HCG, beta HCG, that we test, that's the P stick, everybody. That's a weak stimulator of the thyroid. That's also trying to recruit thyroid hormone for baby as well. So, with fertility, we've got the connection with thyroid health. Even if you don't want to have a baby, you still care about your thyroid health because it's going to be like everything in terms of like getting up out of bed and like having great hair and great skin. Who doesn't want that? But in addition to that, you can see irregular periods. And this is what drives me nuts is when, I've had doctors say to me, when I'm like, why'd you put her on the pill and you didn't test her thyroid first? And they're like, thyroid disease is so rare. I'm like, who told you that? Like, where'd you get that information from? No, it's not that rare. And, something women should also be aware of is that when you have a baby, that can actually trigger an autoimmune condition. And 1 in 12 women worldwide develop postpartum thyroiditis, which is been thought to be a transient hypothyroidism, a transient autoimmune condition. However, about 50% of women will go on to develop hypothyroidism with subsequent pregnancies. So this is autoimmunity, right? You can't cure it, but you can put it into remission. And so this is something that takes place is like you have a baby, you can trigger the autoimmunity, and at 12 months postpartum, you may very well go back into remission, and then another triggering event like having a baby could bring it back up.
If you could give just one piece of advice to somebody who's wanting to make a shift in their health or their life, what would it be?
Be gentle with yourself. It takes time to change. You're a complex biological system. And if you're coming from a paradigm that has taught you, if you have a headache, you take a pill and the headache is gone, it can feel really frustrating or like you're not doing something right. And so really be gentle with yourself and understand that there is a lot of true information. In this interview, we've shared a lot of true information, but is it true for you is the question that you need to be asking. So slow and steady wins the race. Complex biological systems don't change overnight. In some ways they can, but for the most part, if you're trying to shift your hormones, it's going to take usually 3 months or more to really see significant change. But that's just to say that you're not necessarily doing anything wrong. Be gentle with yourself.
Dr. Jolene Brighten, thank you so much for your time, expertise, and passion and everything that you do. And thank you for being a part of The Shift.
Yeah, thank you so much for having me.
I have to say, I've had a girl crush on Dr. Brighten ever since I met her, and I'm so glad she could share this vital info with you guys. Let's review some key points and what action you can take as a result of this. Contraceptive drugs are not the same as natural hormones. We need to be aware of the risks and benefits and carefully weigh up what we think will work best for our bodies. In some cases, they are definitely beneficial, but in others, they could be doing unknown harm, and this is what we need to look out for. We need to be careful about interpreting research that was completed on men when it comes to women's health. Most studies on medications don't include women due to the variability of their hormones. However, it is the same variables that leave them at higher risk of a lot of conditions. There is a 10-year period during puberty where brain-ovarian integration occurs. When a young girl is put on birth control during this maturation period, it could impact her further down the line, and we need to be mindful of the risks to her mental health too. Screening women to see if they're at risk of anxiety and depression could be useful, since these are common side effects of oral contraceptives. Learning is great, but action is better. Here are a few things that you can do as a result of listening to this conversation to help you to shift your health and your life. Make sure you do your research before starting any medication. If you feel unsure of how to assess the risks versus benefits, perhaps see a more integrative doctor or seek a second opinion if you're not completely sure. All drugs come with potential side effects. This doesn't mean that you should not take them, but if you are aware of the risks, then you can support yourself accordingly. When starting any contraceptive drugs, keep track of any symptoms you're experiencing and monitor for changes. This is especially important for mental health symptoms, as often these changes are not recognised as being from your contraception and can lead to misdiagnosis and further medications down the line. Look after your hormonal health by eating well, exercising, and taking care of your mental health. Your period is a barometer for your health, and any changes can give you clues that you may need some attention. A huge thank you to Dr. Jolene Brighten for her wealth of knowledge and expertise. It was so great to meet with her and bring this information to you. Dr. Brighten is about to release a new book called Is This Normal? I'd highly recommend you grab a copy. You can find out more and get her books at drbrighten.com. That's drbrighten.com, or check her out on Instagram. Sharing is caring, so if you like this episode, please let us know by sharing on social media and tagging Dr. Brighten and myself, Katherine Maslin, or the Shift Clinic so that we can hear what you have to say. In the next episode of the Shift Expert series, we have Dr. Marvin Singh, an integrative gastroenterologist that is incredibly passionate about precision healthcare. I can't wait to share it with you.
Coming up on The Shift.
We know that our brain can impact our microbiome, and the microbiome can impact the brain. But once they really understand how the operating manual is written for their body, you see such remarkable changes. And it's that chronic stress where your body is feeling these signals of the lion or the tiger in the jungle chasing you. It's fascinating to me to see that separation of a child from the mother at birth can cause shifts in the microbiome that could cause that child to grow up to have anxiety.
This series is a production of The Shift Clinic. Hosted by Katherine Maslin. Music and sound design by Shade Furlong. Thank you to all of our experts. For more details on them, go to theshiftclinic.com.
We can be. We must be.
The first generation to end extreme poverty.
The generation most determined to fight injustice
and inequality.
The generation that saves the planet
from climate change.
And this is how we will get it done.
The global goals.
A 15-year plan for everyone, everywhere.
With no one left behind.
The global goals are a framework that collectively help us
support the health of our people
and the planet.
At Shift, we are ambassadors for the global goals.
This project supports global goal number 6.
Clean water and sanitation.
Every time you listen
to an episode of The Shift,
we provide a day's access to clean water
for a human in need
in Malawi, Africa.
Water is the foundation to health, and we believe
every human should have access
to clean, healthy water.
So please share this podcast wide
and keep tuning in
so we can impact those who need it the most.